All right, good afternoon, everyone. Thank you very much for being here. Is it okay? This sound? Perfect. So it's really a pleasure to be here at the Peer International Conference, especially here in Valencia. Today, we're going to present to you Transforming Health, University Hospitals as Knowledge-Generating Institutions, and also, a closer look at the Méderi Hospital Network case. So my name is Carlos Lasso. I am the Solutions Engineer and Sales Consultant for Latin America and the Southeast of the United States at Elsevier. And as Matthias mentioned, unfortunately, Dr. Murcia could not be with us in person today, but she has graciously prepared a video presentation to share her insights with us. So she is Dr. Luisa Murcia-Soriano. She is the research epidemiologist at Méderi Hospital Network in Colombia. And basically, because this is the first time a Colombian institution is participating at this Peer International Conference, I would like to provide a brief context on Colombia and also on Méderi Hospital. A quick dive in SciVal reveals over 140,000 research outputs attributed to Colombia, with an impressive 56% classified as open access. The collaborative spirit shines through with 136,000 authors contributing to these works, and also accumulating a commendable 1.8 million citations. By looking at the relative publication share per subject area, medicine emerges as the leading one, capturing a significant 25.4% in the publication share. A standout performance indicator in Colombia's remarkable 47% international collaboration rate, underscoring the nation's dedication to fostering global partnerships and knowledge exchange. With Méderi Hospital at the forefront of this dynamic ecosystem, they've embarked on a journey of discovery and innovation, contributing with 315 research outputs, 344 authors, over 2,000 citations, and 21.3% of international collaboration. Now I would like to provide some context on healthcare institutions. So we all know that hospitals and health institutions play a vital role in shaping the fabric of our society and also safeguarding the well-being of individuals and communities. Beyond serving as places of healing and medical care, these institutions stand as pillars of support, compassion, and hope in times of illness and crisis. Healthcare institutions serve as invaluable sources of expertise, offering insights, guidance, and best practices to help patients navigate their health and well-being journeys. By tapping into the collective wisdom of healthcare professionalism, patients can foster a culture of health and resilience that positively impacts their lives and also their loved ones. Finally, the research conducted within hospitals and health institutions stands as a beacon of innovation and progress, fueling significant advances in the treatment and prevention of diseases worldwide. These tireless efforts not only enhance medical knowledge and clinical practice, but also hold the potential to revolutionize patient care and outcomes. So this is the roadmap to be used during the presentation to present this university hospital. As a healthcare institution, what are its characteristics, the processes, the functions that make it a knowledge-generating source, with a strategic vision that consolidates and contributes to this knowledge, with the policies, strategies, and resources needed to develop these processes, the results that have been achieved up to date, and how in all this framework of research results and processes, the hospital has implemented a CRIS system. Now I want to welcome Dr. Luisa Murcia-Soriano.
Thank you so much, Carlos, for the introduction and to the organizer for inviting me to participate in this important event. I am honored to have the opportunity to present a case that it's a bit different from what we usually see in Latin America. Today, I will share with you the experience of Méderi University Hospital in implementing a research information management system, showing how a healthcare institution can also be a center for generating knowledge. As Carlos mentioned previously, this presentation will begin by introducing Méderi University Hospital, located in Bogotá, capital of Colombia, a suitable place to study and understand processes that contribute to explore and find new knowledge. Our environment is rich in diversity. Every day, more than 5,000 workers and nearly 2,000 students from different disciplines participate in clinical practice activities. This combination of roles and processes create a vibrant ecosystem where teaching and research come together to generate new knowledge. In this environment, healthcare staff not only provide medical care to communities and patients, but also assume teaching roles and share their knowledge with future health professionals. Meanwhile, students are eager to learn and, through their clinical experiences, constantly identify new research questions and gaps in knowledge that need to be addressed. Patients, who are the heart of our hospital, have complex needs from a biopsychosocial perspective. This drives us to respond with the best scientific evidence available, adapted to our local context, and enriched with standardized clinical protocols. We also work with experts in technical, scientific, and technological fields who play a crucial role in improving our care activities. It's in this environment that we present our strategic vision to be an organization of excellence in healthcare, academic training, research, and humanization, with the best health results. Which is why the hospital has created policies, lines, strategies, and resources to ensure the quality of research activities. In this context, since we established the research department in 2012, we have followed a clear research policy aimed at developing studies that directly benefit our population. Our mission is to generate knowledge that address the specific needs of our patient, complying with the ethical standards and adhering to national and international regulation. On the other hand, to ensure the quality of our research, we have implemented expert methodological support strategies in statistics and methods, and we have identified the importance of structured data records and clinical registries. These databases are essential to collect high-quality information to structure new research projects. We are also committed to funding high-quality research, supporting the best research proposals, and sharing results widely. Also, we recognize the importance of continuous training of our researchers. That's why we have established master's and doctoral funding programs, ensuring our staff develop the skills necessary to carry out high-level research. And finally, we are on the way to consolidate our Health Technology Assessment Unit, which is responsible for continually evaluating the technologies available in the country, ensuring that our patients receive the best possible care. And we have also established an evidence synthesis unit, which promotes critical thinking among our professionals, helping them navigate through the scientific literature and synthesize evidence to generate new knowledge relevant to our clinical practice. All of these actions are framed within our open science model based on these four pillars: research integrity, open scientific knowledge, open data, and citizen science. Now, why am I describing all this to you? Because all the information derived from all of these strategies and action in research must be centralized and structured. That's why we found Impure the right tool to do it. So to finish this speech, I'd like to talk about the implementation of PURE at Méderi University Hospital, which marked a significant change in the way we managed research information. Our main goal was to find a solution that could centralize information efficiently and was flexible enough to adapt to the dynamic nature of our hospital environment. Before, pure research information management was fragmented and often laborious with multiple systems that didn't integrate well, creating redundancy and making critical data difficult to access. We chose Pure because it integrates seamlessly with our operation, creating a unified system that brings all the research activities under one roof. The integration of Pure has allowed us to streamline the monitoring of research projects from the start to finish. We can now more accurately follow each stage of research process, from submitting proposals to publishing results, ensuring that each step comply with internal and external regulation. A particularly useful feature of Pure is the ability to handle large volume of data efficiently. This has been especially helpful for us as the number of ongoing research projects and the variety of data generated can be overwhelming. This has greatly reduced time spent on administrative tasks, allowing our staff to focus more on their research activities. Additionally, Pure helps us to collect key performance indicators, providing real-time data on the status of research project, which is crucial for decision-making and planning. We have improved the efficiency of research management. Researchers now have related access to a centralized system where they can record, manage, and access all their scientific projects and data. And it is at this point that we find another key benefit of Pure: greater visibility of our researches, that the platform makes your work easily accessible to colleagues within the hospital and to external collaborators. This not only promotes internal collaboration but also positions Méderi University Hospital as a leader in medical research in the region and beyond. What have we learned from this process? Looking to the future, it is important to use various complementary tools to help us in research management. We are continually improving, but we know we can still do more to make everything work better and get better results. As we move forward, it is important to focus, learn to prioritize, make plans, and define indicators. It is a continuous training and development process that must also adapt to the constant evolution of our hospital and of our context. And what's the next for Méderi? I invite you to learn more about our professionals, our research units, our results, and how we continue to build a solid academic community. We are the first hospital in Latin America to implement this system, and we hope to continue leading the way. Thank you all for attending this presentation, and feel free to contact me with any question.
All right, so that was about Méderi University Hospital. As Dr. Luisa mentioned, it is the first and only hospital in Latin America using Pure as the CRIS system. This has allowed us to start communicating with other institutions, healthcare institutions in Latin America. We recently launched a webinar with Dr. Luisa as well, targeted specifically to the different healthcare institutions with a very good attendance. So this is, of course, one of the beacon institutions that others can refer to in the future. For at least for Latin America. We know in other regions there are other institutions that has Pure as their CRIS system, but of course the regional target is very important for us. So thank you very much.
Thank you. Are there any questions from the audience that maybe Carlos can answer directly, or anything we should take forward to?
So I have Dr. Luisa, available for for answering questions if there's any.
She got up very early.
Yeah, it's 6 o'clock in the morning in Colombia, so. Or 7. Yeah, 7 o'clock. Yes. All right. Let me see.
Thank you. I was wondering, as you sort of organize the data that's going to go into Pure from the hospital and some of the research, are there any specific privacy or concerns for clinical information that might end up in there?
Well, something must have happened, but what probably Matthias mentioned is, we can take this question and note it, and then ask her offline if you want to. Sorry. Thank you.
Any other comment or question at this point? Okay. Thank you very much again. Your break for coffee break now, and I think we reconvene. Correct me if I'm wrong, at 2:30, correct?
Perfect. Thank you very much.